when you get into medicine itself, you start to see that there's a lot of diseases that come as a result of poor lifestyle choices. And through my practice, I sort of got to see those things happen, got exposed to patients who experienced that. I myself had my own experiences with health and stuff. So I decided to pursue something that would potentially reverse some of these things.
Welcome to Reclamation, the podcast where conversations meet practical insights, guiding you through the maze of behavioral science to empower better public health outcomes. With a passion for bridging the gap between medicine, psychology, and sociology, Tabo brings a unique perspective to every episode. Get ready to reclaim your understanding of health and behavior. This is Reclamation.
Welcome to yet another episode of Reclamation Podcast. You know how a lot of times we're really struggling to make the changes we want to, even if we know we are supposed to. And it's going to benefit our health if we actually make the changes and figure out ways to actually implement those changes, not only think about them and set a goal and dream about them, but actually put action to the knowledge that you have. And today I have a very passionate medical doctor with me who is so passionate about lifestyle medicine and about reversing chronic diseases, about managing chronic diseases, and about using behavioral interventions to be able to actually manage the chronic diseases that we see so many times in Zambia and generally in the globe. I have with me Dr. Kakungu Kaite. Dr. Kakungu, welcome to Reclamation Podcast.
Thank you so much. It's a pleasure to be here.
Yes. So you're passionate about lifestyle medicine.
Very much so.
What is lifestyle medicine and why are you passionate about it? Because someone who's probably listening is like, lifestyle medicine, what is that?
Yeah, it sounds strange. It's something relatively new around these parts, but globally it's something that's been there since 2004 officially.
Oh, okay.
Yeah, but essentially it's a field of medicine. Keywords, it's in medicine. It's not something strange.
I mean, the lifestyle medicine. But
Exactly. It's one that promotes lifestyle changes that will help you prevent developing chronic diseases, at least reduce the risk, help you manage them in a better way. Okay. And then if you do it at an intensive level, it allows you to potentially reverse some of these diseases. So the ones which are called non-communicable diseases, commonly the diabetes, your hypertension and some cancers, things like that.
Okay. That's actually interesting. So you believe we can actually reverse a lot of these diseases, like hypertension?
Yes, I do. I know it's not commonplace for that to be said. It can seem like I'm going against all the medicine that I learned before. But evidence does suggest that a lot of these things can be reversed with the right interventions.
Okay, so where did this idea of yours stem from? Where did the passion come from?
Yeah, that's a very long story. But it starts out in the church. To be honest, Seventh-day Adventists. Seventh-day Adventists tend to promote a healthy lifestyle as something that Christians must adopt in order for them to experience essentially the best of life, So it starts out there, but then when you get into medicine itself, you start to see that there's a lot of diseases that come as a result of poor lifestyle choices. And through my practice, I sort of got to see those things happen, got exposed to patients who experienced that. I myself had my own experiences with health and stuff. Okay. So I decided to pursue something that would potentially reverse some of these things. Because I've heard about reversal and this and that and the other. But then I never actually found a field that was focused on that. So it's just providentially, honestly, that I came across lifestyle medicine as it's practiced in the United States. And I couldn't help but jump on board, to be honest, because it's sort of what I hope my life will be described by, something like that. Okay. Or informed by as well.
So would you say you're currently practicing lifestyle medicine?
Yes.
Okay, how are you doing that? Because I know a lot of people have not heard about that in Zambia,
So primarily, it means I watch what I eat. I try and make sure that my nutrition is one that improves my health status. Because whatever you eat, with every spoon, you're either going towards death or you're going towards life.
That's Sounds an interesting way to put it.
It is, but it's true. So watching what I eat, eating the kind of foods that will heal essentially your body. There's a quote that says, "Let food be thy medicine, or medicine will be thy food." So essentially, it's eat the right things that heal the body and avoid the toxic things that destroy over time. So there's that aspect. Then there's an exercise aspect, actually more physical activity than exercise. So living a lifestyle that is not sedentary, not just sitting and, in an office and, all day and doing all of those things. It's keeping your body active, because that seems to be associated with having a longer and more healthy life. People have been doing studies over long periods of time that indicate that those who are more active tend to live longer lives. So we need to practice that, and I try to do that as well. Aside from that, learn to manage stress, avoid toxic substances, tobacco, alcohol, or at least, if you can't avoid them, limit their use to at least what I would say, quote unquote, healthy levels. There's no healthy level, but reduce it to a level that is, I say, accepted by maybe most guidelines, but maybe not everyone. Then having good relationships, networking with like-minded individuals like yourself, and just building relationships with other people.
That would help with the disease management?
Really, really does. It's underestimated, actually. There's a study that was done. It's called the Harvard Study of Adult Development.
Yeah.
It lasted 8 years. 8 years. And they studied people with different nutritions, people who exercise, and they tried to see which factor contributes the most to longevity. And they found that it was good social connections.
Wow.
Not even diet and not exercise. Social connections were the biggest factor, which is very, very interesting.
Okay, not to go off topic, but I'm wondering, do you think that is realistic? Though in our busy, with load shedding now, we're so stressed, you're just barely able to afford the basic needs. And you're now telling people to say, okay, even as you're buying this food, buy it in this way. And even as you're doing these activities, you need to sit on the computer and get work done. Make sure you incorporate exercise. Like, how realistic are those suggestions you're giving? Because they might just seem like far-fetched dream for someone.
Yeah, that's very true. And it's a very good point. And that's why I would say, for starters, on the exercise bit, what we promote in lifestyle medicine is not necessarily exercise, like going to the gym and having to go running. It's just being more active in whatever space you're in. So what it would look like in the home is, since there's load shedding, maybe we're not even using washing machines. Yeah. But, instead of using a washing machine, hand wash. Like, instead of delegating certain tasks, hanging clothes outside, hang them yourself. Walk the dog. Just natural activities that tend to have an additive effect when it comes to improving our health. So it's not expensive things in terms of going to buy, go buy pistachio nuts, go and buy these from Woolies. It's not the expensive options. It's within what you have, what options can you create and put together in a simple way that will help improve your health. And it's easy to think it's difficult, but that's just because we've not been taught about the simple steps that can be taken. And that's hopefully what we can introduce to everyone around, so that they know it's accessible. It's not complicated. I'm not even rich, but I'm managing to do something at least. So everybody has the option.
Okay, so what I'm getting is mainly just about trying to look at the options you have and try to pick the best options out of the maybe terrible looking ones, but trying to just go for the best.
Yes.
And getting as much control as you can over that. And
when you see the differences, it gives you the impetus to continue. It's like, okay, now I've noticed I'm feeling better just
so
after making this change. It motivates you to continue. And who knows the limits of that,
Okay.
Yeah.
All right. So you mentioned that behavioral medicine can actually prevent some diseases. So let's say we have somebody who comes and says, my family all have diabetes, because that's one of the diseases you did list down. They have diabetes, but I'm good. I've done the tests. My blood work is okay, but I would really like to prevent it in a way. Where do you start off with a person like that, an individual like that?
Yeah, and that's a really good approach. I would really love somebody to come like that, with all of those risks, but wanting to be proactive.
Because a lot of us don't do that.
Exactly.
We wait for it to hit you.
Exactly.
Even when you can see the truck coming.
No, first let it hit me, then I'll be forced to make those changes. So first I'll start by commending the person for realizing that they're at risk of developing it. That's a very good recognition, and it gives confidence that they will follow through with some of the interventions that need to come afterwards. So the primary thing that would start with is the diet that the person is taking, because that one contributes the most. The kind of foods that we eat. Think about Zambia. We know the foods that are there. I'm not going to label any particular places, but running away from fast foods, staying away from processed foods, even packaged fruit drinks sometimes can have high doses or concentrations of sugar which do contribute to poor health. But then they're marketed as healthy, as 100% fruit juice. So some people may think, okay, so this is fine for me to take. But stay away from most of the processed things and eat food that is closer to its natural state as possible. So avoiding that, trying to avoid packaged foods or limiting them, reducing salt intake as well. Mostly we discuss it as relates to hypertension, but even for diabetes, it's the same underlying mechanism that can lead to both of these diseases. So rather than saying, reduce the amount of salt that you add at the table, that is a good point. But most of the salt that people take in, according to studies, it says about 70% of the salt intake comes from processed foods or packaged foods. So rather than saying don't add salt at the table, tell them avoid packaged foods. And that reduces the risk. So it has been working, helping different individuals just adjusting their diet, incorporating exercise at timed intervals and manipulating those things with the care of a physician. It works wonders, honestly. So if the person would really want to reduce those risks, we'll talk about the different pillars in lifestyle medicine, we'll adjust their diet, help them manage their stress, we'll include physical activity in their exercise, we'll let them avoid toxic substances. And who knows, they may not develop it at all because the risks are actually modifiable, even though the hereditary risk they would have gained was non-modifiable.
Okay, so what if they actually now do get it despite doing that? How do you reverse or manage it? And how? Also, I'm curious, okay, this is probably a loaded question, or there's so many questions. How would you be able to distinguish between somebody who you would be able to reverse the condition and others where you just have to manage?
That's a loaded question. Very good. But I think it's good to illustrate the point. So most of the interventions that need to be made for an individual who does already have diabetes need to be intensive. That's for starters. It means we're not going to say, okay, just reduce on your chips, for example. That's not going to lead to reversal. The relationship with reversal is dose dependent. So if you increase the intensity of the intervention that you make, you increase the likelihood of them getting to reversal.
When you use the word intensity, that sounds very, very scary. Like it's already mentally too much work.
It does really sound like that. But I'm trying to go with the worst case scenario. There's stories, not stories, that makes them sound like they were made up. There's evidence of people as old as 75 years old who have had diabetes for over 20 years, who've managed to achieve remission just after adjusting their diet, their physical exercise, and a few other elements without starting medications. And these are people who were on medications, who've had diabetic complications. They've gone so far in their DM, but then when you initiate an intensive therapy, which is not to say it's bad, but it's intentional. It reflects the extent.
Very hard. But it's definitely worth it.
It's by contrast to the taking of medication every day, maybe injecting yourself with insulin every day, the social dynamics that are changed because of having to make considerations. it's actually much, much lighter. It may seem like a burden, but because of the benefits that you see quite early on as well,
the return is worth it.
You find that, why didn't I do this sooner? It sounds intense when you're not doing it, but it's actually fairly okay. The challenge is just that from the onset, you can't really tell whether this individual will be a case of management or a case of reversal. It really depends on how they respond to some of the interventions that are done. The truth is that for every individual that these lifestyle changes are initiated on, there's an improvement. Whether it means the reduction in their medication doses, reduction in their insulin requirements, or reduction in the progress to complications of diabetes, there's always an improvement. The extent of that improvement is partially dependent on how willing they are to go far. It's not to starve. It's not punishment. It's quite a good process. But how willing they are to follow up with those interventions for a long period, even up to 6 months. For some people, even up to a year, if they're willing to go on with those steps, they could reach remission. So there's different studies that show the percentages of people that get there, but I would not be one to say from the onset to someone, look, you are going to reach remission.
Yeah.
Like, I don't want to overpromise. Like, you need to keep expectations in check. But from the few clients that I've seen, a lot of them are very close to remission. One is in remission.
Wow.
So honestly, there's hope. And I think that's a message that people need to take from this.
Wow. Okay, that's actually very, very encouraging to hear. And I'm hoping it's motivation enough for somebody to take that step and try to make the change.
I agree with you.
So when you say lifestyle, because you mentioned how for some people it might take 6 months and for others it might even be a year. But then what happens after that? Because lifestyle is like something really long term.
Completely agreed. Yeah. So the programs depend on the individual, like I said before. So if we did a program or initiated a program for 6 months, it means you have an individual who's trained in reversal or in treatment or management, guiding you along those steps throughout the 6 months, 3 months, or whatever period. During that time, you're learning your body. You're learning how your body responds to different situations, learning how your body responds to different foods. You're learning what causes your blood sugar to rise, what causes it to drop, and all of those things. So that by the end of that period, or maybe even earlier, you don't need to pay for whatever services so that you can manage yourself. For some people, even within 6 weeks, you're able to manage yourself. You've learned what you need to do in order to avoid certain things, and you continue on your own journey. The challenge with them is if you stop,
you're back.
You're back to being at risk.
Yeah.
So you have to maintain the lifestyle change. And it's not that hard. Our bodies are designed to adapt to different situations. Fortunately, I believe that's how God made us. So once we continue to practice a certain lifestyle for some time, it sticks and it becomes very, very rewarding because you see all of the benefits that you're experiencing. Okay. Yeah.
We have this, I don't know whether it's a misconception or it's a conception, but generally people are scared of starting interventions of any kind, not only just health, because they feel if I stop, it might actually be worse because you're thinking of the risk of you not going through with what you've signed up for, and then you abruptly stop, and then maybe you're even in a worse situation than you began. Do you see that a lot, or do you think that's a possibility when we're talking about lifestyle medicine and the chronic diseases?
Yeah, so in lifestyle medicine, I wouldn't say you're at increased risk if you start lifestyle practices and then take them away, because already most of us lifestyles are not so great. We're already on
it feels like an attack, but yeah.
Well, most of us will know that we're culprits in one way or another. So when we start to initiate these changes and we start to experience some of the benefits and then we stop, we just take ourselves back to the beginning, where we were before. It's not that taking away, it's not like medication. You said that's one of the downsides. And I'm not bashing medicines. They have their place. Definitely.
You're a medical doctor after all,
and I prescribe medications every now and then. The point is just that medications have their place. But for some time, if you give someone medication and they abruptly stop, there's certain side effects that can come as a result of that. For lifestyle changes, not so much. The extent of these adverse effects or even the potential for you to experience them is not very high. So that's what I would have to say about that one.
Okay. So I'm just curious because this seems like really something amazing. And looking at the prevalence of these diseases now, I'm wondering why hasn't this been a thing in Zambia? I like that you're actually doing that. I like that you've decided to start the Lifestyle Medicine Institute right here in Zambia. But why now? What has been happening? Because is this new knowledge, lifestyle medicine? Has it just been discovered in Africa? Because you did mention to say quite all right, it's been there since 2004. Yeah, but then here in Zambia, have chronic diseases not been our issue?
Yeah, so, part of the story is that mostly we've been plagued by infectious diseases, as from time immemorial. Not so much in this new generation, but before our concerns were infection, typhoid, HIV, malaria. Those are the things that are primarily even funded and things like that. So people have not been very responsive to the transition in lifestyles, the increase in the number of fast food places, because Zambia has become a little bit more developed. Yeah. There's more access to we used to walk to school once upon a time.
Life is convenient.
Life
now.
has become a lot
Soft
more
life.
convenient. Exactly. So there's certain consequences that come as a result of that progression. And rather than being proactive, I think we've been very reactive. We're waiting for the catastrophe, which has essentially come. Because now we've got strokes on the rise. They're very, very high. But the good part is, even though we're a little bit late, the good part is we're starting to make these changes. But have they been there all along? I believe so. When you look at guidelines for hypertension management, for example, from American Heart Association, if you've got normal blood pressures, the advice that they give you is you must make appropriate lifestyle changes so that you maintain normal blood pressures. If your blood pressure is slightly elevated, the advice is lifestyle changes. That's this, from time immemorial. That's 120 to 129 for the systolic BP, the upper number for anybody who knows blood pressure.
I hear you, but I'm wondering, are we actually practicing this in the hospitals? Are we, besides the 10 minutes we see the patient and give them the antihypertensive and tell them a bit about salt and exercise, but
in a rushed way.
Yes, in a rushed way.
I hear what you're saying, and no, we've not been practicing it. And the hope is that with the Institute, we'd be able to make this something that is the primary intervention, not the only, but the primary intervention that is done, because it's almost at the bedrock of every disease process that is happening. Almost any individual, let me not even mince my words, every individual can benefit from lifestyle changes, whether healthy or not. Even more so for people who are already taking medication of any sort, because then their body is better able to process some of the drugs and things like that. So it's not something we are doing actively, but hopefully that will change very, very soon.
Okay. And you've been doing this for a little less than a year, right? Mm-hmm. What challenges have you faced? Because I'm sure with your peers there, when all you're doing is the pharmacological and the actual medical part, and you're now trying to convince colleagues to say, let's try and look at it in this way. I can only imagine that as one of the challenges, but please do share your experience with in the health sector that you can.
Yeah, it can be a little bit difficult, to be honest, It can be, you're laughing, you see, how it is. It's because anything new, any introduction of anything that is new in inverted commas can be quite challenging. So where to place lifestyle medicine? Is it conventional medicine? No, it's not really conventional medicine. Is it a traditional medicine that is practiced with no evidence basis, with no specific doses and things like that? No, it's also not there. It seems to be somewhere in between. And in a world where people like things black and white, it becomes very difficult for me
for
to
the
stand.
mind to process.
Yeah. People are thinking, okay, but like he's a doctor, right? He's still going to give me Coartem for malaria. And they're like, yes, definitely. But in addition to giving you the drug treatment, if it's necessary, there'll be a whole lot of other steps. So it's a little bit difficult to convince a population about the fact that medicine and lifestyle medicine coexist in the same space very safely with no contradictions. But then more than that, it's also a little challenging because in Zambia, we do not have lifestyle medicine as a specialty that is recognized. So even if I were to become qualified as a lifestyle medicine physician in a few months, it's not recognized here I won't be recognized as a specialist. So if the governing bodies do not recognize me as a specialist, what does that mean then? There's those nuances that have to be managed. But I guess since we're still in our infancy as LMI, we'll learn how to navigate the space over the next couple of months.
Okay. You mentioned how you're going to be board certified very soon. You're going to be a lifestyle medicine physician, right?
That's right.
And we don't have those in Zambia, do we? I've not heard of any in my practice.
No, as far as I know, we don't have any in Zambia. And according to the
you
records,
might be the first.
I will be the first.
Congratulations.
Thanks in advance. I'll come back and tell you about it.
When is this supposed to happen?
I have an exam at the end of November. And God willing, if that goes well, by the beginning of next year, I would be certified.
Okay, that sounds really great.
Yeah.
So we can expect to see some change in Zambia because something new is coming.
Yeah. God willing, let's look forward to that.
Okay, could you tell us a bit about LMI? What plans do you have for it? Because I know you're going to be certified soon and you've been trying to raise awareness on the importance of lifestyle medicine and all that. So what do you plan for it exactly? If someone is like, LMI, what is it? What's the plan? What's the vision?
How much time do you have? I can talk all day.
I know you can, but I'll just give you 2 minutes for this.
Okay, good. So there's a lot that I have planned with LMI. It's kind of my little child, if I can put it that way. But for starters, one of the plans is to integrate lifestyle change training into primary care facilities. So you don't have to go to the hospital and just get medication. You can get advice on how to prevent getting sick. So I want to make it a little bit normal for people to go to seek care in order to prevent disease, not just to go to seek care when they're already sick. Yeah, not just to seek treatment. So LMI is hopefully supposed to be a center that spearheads that movement where people are more focused on the prevention aspect for most diseases. In addition to that, in working with hospitals, one of the other elements is to have a facility somewhere. There's one called Riverside in Kafiwe, which is probably known by a few people, where you can go there and have certain interventions done for a period of time, and hopefully you have an improvement in your state, whether it's weight that is trying to be controlled, whether it's hypertension, whatever it is. We hope that as LMI, one day we can have
something like
a facility like that where we can initiate intensive therapeutic lifestyle change and start to collect evidence to show people how it actually works. So there's another research arm, which is important. People don't trust new things generally. So you need to show them. Exactly. So we're hoping to be given opportunity to be able to show people the actual impact, not from other places in the world, but from right here in Zambia. So there's that research arm as well. But beyond that, we want to influence policy, which needs research.
That's the most important thing after all.
That's the most important thing. That's what creates magnified impact. So we want to influence policy so that we can make the healthy choice the easier choice, if I can put it that way. Yeah. I think that's the easiest. But the ultimate is hopefully at the end of, 10 years or whatever it is, we can have a blue zone in Zambia. And a blue zone not as Zambia as a whole, but a particular region in Zambia. A blue zone is essentially an area where people live exceptionally long. And, those sort of areas are studied. There's a couple across the road, I think 6 or 7, but they've been brought to the global stage because of the length of life people live and the quality of life that they experience. So it would be great to put Zambia on the map for having a blue zone. And then we can learn lessons from that, which will help everybody, honestly. That's about it.
Sounds like a beautiful ambition. It does. I like it. And now I'm wondering to say, are you doing anything to what's the word? But to reach out to people away from Lusaka as well when it comes to lifestyle changes? Or do you think those in the rural areas are okay because they're already physically active and are not taking in as much processed food?
So, it's almost a trick question, but we do intend to reach out into the rural areas. We have very serious intentions. We just need to make plans for it because it's not starting something new again that's not necessarily very well funded. You need to look for partnerships with people who can help sponsor certain interventions, certain programs. So we're trying to work aggressively to get that. But people in rural areas are not exempt. Interestingly, even amongst people who are vegetarians, there are certain risks that are heightened because of the way they practice their vegetarianism. So in rural areas, while they may not have access to certain fast foods and processed foods that we may have in our areas, there is a way in which they combine their diet which could heighten the risks that they have for certain diseases. And actually, when you go through government hospitals, you find some of the people suffering from these conditions are from rural areas. Quite a good number of them will still be from rural areas because government hospitals don't necessarily cater to some of the very rich people in society. So we know that those problems they cut across socioeconomic boundaries. So we need to find a solution that also cuts across these boundaries. And somehow lifestyle change, because it's inexpensive and accessible for everyone, seems to be one of the common denominators. So hopefully we'll be able to find a way, an intelligent way of reaching all the rungs of society so that the benefit cuts across the board.
Okay, that sounds beautiful. So I know you're not yet, but you're on your way to becoming a lifestyle physician. So what is the one important lifestyle modification that you would encourage or want as many people as possible to adopt? Somebody who's just decided they want to be deliberate about their health and make a change. What is that one or two simple things that they can start with, even as they end this episode here?
Okay. So the common one is the one I'll start with. And the most common one is the nutrition aspect, the diet. All I'll say on that one is try and eat as little takeout as possible, as little fast foods, as little processed foods, and increase consumption of water. I think as a baseline, so that we don't make things complicated, that will change a lot of your life. Maybe in addition to the same one on nutrition, eat a lot more whole foods, things which have a lot of fiber. Most of the diets that we have now are very low in fiber, and that's one of the reasons why they're not good for our bodies. So we increase fiber by increasing green leafy vegetables, we increase our fruit intake and things like that. So that's one piece. Second piece, I know there's people who participate in the marathons now. They've become common and popular. So even gyms now, they're usually packed. So I won't say exercise. I will say avoid being sedentary. Most of us spend time, whether doctors or professionals in other spaces, most of us spend time in the office from 8 to 5, sitting in front of a desk, in front of a computer, working away. The only time we get where we're not working is probably during lunchtime. But because we spend so much time seated, I read something that says sitting is a lethal activity. I need to share this paper actually at one point. But sitting actually increases your risk of all-cause mortality. Just increasing the amount of time you spend sitting, whether it's in front of the TV or working.
Yeah.
So the advice would be sit less, move more.
be busy.
Yeah.
Well, not busy seated, because nowadays you can be very busy on your sofa. Okay. Well, thank you very much for that. That's very insightful, and I'm glad you actually accepted to come here and have this conversation, because these are not conversations that people are actively having, especially now when we're so overwhelmed with trying to meet our basic needs and all.
Yeah.
So when I reached out to you and asked you to come on for an episode, I'm sure you had something in mind about what you're going to talk about. Is there one particular thing that you had wanted to share that I've not asked about that you could share in a minute?
Yeah, I wouldn't even say there was anything specific. It had nothing to do with me. It had to do with you. Like, look, honestly, whatever got you to this point, starting this podcast and everything, it's something that I hope is going to be spread across all of Zambia and even beyond, because the opportunity to have these conversations, not just this one, the other episodes that you've had along the way are very informative, and they have real potential to transform people's lives if they actually do listen. So what I wanted to say, not from my end, but to you, was thank you. Aww. Thank you for starting this. It's brilliant. And I hope
having guests like you keeps me going, because then I know to say we're doing something solid and we're making a change together. So.
Definitely, and happy to be a part of that journey of yours.
Okay, so if somebody liked what they heard, how can they reach you? Would you have pages on social media, website?
Yes, so we have pages on LinkedIn. The page is called LMI Health. And on Instagram, we can be followed with the same handle, LMI Health. We're yet to open a website. This one will be launched at New Year. On New Year's Day, actually, is when we're going to have the website launched.
Okay.
So the only other one would be my email, which is Dr. K, all small letters, at lmihealth.org. People can reach me through any of those.
Okay, so you heard the doctor. He's explained what we should do and what we shouldn't do to get our health on track. I'll be sure to attach the links to his social media handles for LMI and his personal profile as well. Thank you so much for coming through, and I hope you got something from today's episode. Keep moving, eat healthy, and you'll be okay. Thank you for joining me till the very end. In the world of behavioral science, every ending is just the beginning of something new. Please remember to subscribe, leave a comment, and stay tuned for more adventures in behavioral science as we continue our journey towards a healthier, more informed decision making. Until then, stay curious, stay vigilant, stay healthy. This is Tabo Lukato Hadonka signing off from Reclamation.